Hello, everybody, and thank you for taking a little bit of time out of your busy days to join us and talk about some very important topics. We appreciate your time and your attention, and know that things are really sort of crazy now everywhere in not only the country but the world. So we appreciate your business, your attention, your time, and please, as we go through this presentation, if you have any questions or if there's anything that we can do to assist you, then please reach out to us. We have a wonderful team available on the chat system for GoToMeeting that can answer the questions that you have for us. My name is Tony Peterson. I'm the Director of VAR Sales at NexTrust, and I've been in healthcare for about 21 years, most of that working with practice management and EHR systems. And so today we're going to be talking about how you maintain patient care, billing, and payments during uncertain times. Seems like a very timely topic given the different restrictions that are in society right now. Patients are being told that they need to socially distance themselves from others, stay at home, not interact with different businesses that are out there, and that affects all of us in healthcare. We need to make sure that we continue to provide the care that our patients need. And in order to provide the care that our patients need, that means that we need to get the payments for the services that we offer from as many different places as we can. There's a lot of patients that are going through hard economic times right now, but in order for our practices to keep functioning, we need to get as many of those patients who are able to continue making those payments to be able to do so. And so we'll talk to you today about different strategies that you can utilize to continue to not only bill for the care that you provide, but help you with different options for providing that care. Specifically, we're going to be looking at how you can provide telehealth to your customers and or to your patients, and with that, online patient billing and payments. So not only will you be able to deliver your services, but you'll be able to get paid for them. So let's start this off. If I can get my my PowerPoint to advance here. There we go. We'll start out with the faces of telehealth. This is my third of four sons. I have four boys in our family. His name is Tucker. He's holding our brand new puppy Oreo that we got a couple months ago. But Tucker has a couple of different conditions that he sees his pediatrician on a quarterly basis for. He has to go in every quarter. And
sorry to interrupt.
Yeah.
The slide didn't advance.
The slide didn't advance. I'm glad you did interrupt. So tell me if it advanced now.
Yes, perfect.
All right, thanks, James. So this is my son, Tucker. So we'll go back. I won't tell you all of that again, and our new puppy Oreo, but like I said, Tucker is in with his pediatrician on a quarterly basis, being seen for conditions that require medication. Well, about a week and a half ago, after our area here in Atlanta had been put on different levels of social distancing and what some might call quarantines or equivalents of that, he had his first visit with his pediatrician in order to deal with the conditions that he has. And it was really sort of interesting. The way that visit occurred was that we had to log on and make a payment to the pediatrician before the visit through an online system that allowed us to pay for the visit. And then Tucker visited with his pediatrician over Skype while the doctor was in his home. The entire visit occurred over a live video chat between Tucker and his doctor. And largely, the visit was able to occur the same way that it would have if he was sitting there right in the office with the pediatrician. We were able to complete the visit, pay for the visit, and then go drive through pharmacy and pick up his prescriptions without ever even having to come in direct contact with anybody else. So his pediatrician, due to the use of technology, was able to continue to provide the same level of service or a similar level of service to Tucker as he was before. We want to help you with different options that are out there that can help your businesses continue to provide service to your patients, continue to get paid for as many of those visits as possible, and which will allow you to continue to provide the services that your patients so desperately need. So let's move on and do a quick overview of what we're going to be talking about today. Really, the entire webinar is summed up by saying we're going to help you adapt to the impact that the COVID-19 national emergency is having on the patient care, billing, and payments. And the topics that we're going to discuss, first we'll go through understanding your telehealth options. After we do that, we want to help you with how BillFlash can simplify telehealth billing and payments. You can also utilize BillFlash to remotely send mailed and eBill patient statements. So BillFlash supports social distancing in that the way that you send out not only eBill or electronic patient statements, but mailed patient statements is done in a manner that does not require person-to-person contact. So it supports that as well. We want to help you with how to offer online payments to your patients to promote social distancing. We have found that most of our practices collect the large majority of their payments from patients while the patient is standing in the waiting room waiting to be seen by the doctor before their visit. Well, if the patients aren't able to come into your waiting room by and large anymore, and that's the place where most of the payments were made, then in order for your business to continue to receive those payments that you're able to from patients, you need to offer an online option. And then last but not least, we will talk through how you can set up payment plans to make payments more manageable for those patients who are affected by the coronavirus. As I said earlier, if you have any questions throughout the webinar, we've got Mari, James, and Richard on the phone. They're a wonderful team here at BillFlash, and they'll be monitoring the chat. If there are questions that are applicable to the entire group at the end of our session today, then we'll have Mari read those questions out loud, and I can answer them for everybody on the phone. So if you have anything that you'd like to ask, please don't hesitate to utilize the chat feature on GoToMeeting. So first, let's start with a poll just to see how everybody is doing with regards to telehealth. This poll is really centered around what is your current telehealth use? If you'll take a look at the GoToMeeting interface, there's a couple of different options that are there. We've been providing telehealth visits for a while now. We just started providing telehealth visits. We're looking for a telehealth system. We're unsure of how to start telehealth visits, or we're not going to provide telehealth. And those results are coming in. 40% of you on the phone have voted. It's really rather interesting information. Only 3% of you so far have been providing telehealth visits for a while now. That's down to 2%. 78% of you say you just started providing telehealth visits. Also very interesting, 7% of you are looking for a telehealth system, 13% unsure of how to start telehealth visits, and 0% of you so far are not going to provide telehealth. It's a very good breakdown. I'm glad that all of you understand that there's options that are out there for you. Hopefully this session is going to help you with answering some of the questions that you need. So our final numbers are in. Those are really good. The numbers are about the same as we talked about earlier, so I won't go through them again. Actually have one more question for you because there's a lot of you who said that you were just providing telehealth visits. Our next poll that we have for you, how are you going to send the pre-visit patient charges and receive payments for your telehealth visits? Have you figured all of that out? So there's another poll that's open, and a lot of you are answering those. 14% have voted. The first option is the telehealth system sends charges and payments automatically. The second option is that you use an external system to send charges, And then the last option is we're not sure how to send charges and payments for telehealth visits. The majority of you are answering with the second two options, either using an external system or not sure of how to send charges and payments, and are looking for some help on that. Only 4% of you said that your telehealth system automatically does that for you. 67% of you have voted, so I think we can close the poll on that, guys, and move on with the presentation. Thank you all for your participation in that. That helps us with making sure that the content that we share with you today is valuable to you. All right. So what do you need to know about telehealth? The first thing that is most important for you to understand is that rules and regulations can and do vary from payer to payer. I would also add to that and let you know that the rules and regulations are very fluid right now. The national emergency that has occurred with the coronavirus and COVID-19 have made it so that both insurance payers, software systems, everybody has to adapt fairly quickly to an ever-changing situation. And so there's been a lot of changes that have been made, but they can also change from day to day. So it's important for you to stay up to date on what your payers are saying each day. There have been a lot of previous Medicare or CMS regulations around telehealth and when and how it can be delivered and to whom. HIPAA has also had a lot of regulations that, similar to the CMS regulations, these things have been relaxed. That doesn't mean that you don't have to worry about the regulations, because eventually the national emergency ends and HIPAA is still in place. But for the time being, you need to understand that some of those things have been relaxed, and that can help you and your business get through a very tough time if you need to do something very quickly. Even if you are able to see your patients with a telehealth system, it's critical for the life of your business to understand whether or not you can bill them and get paid for the visit. So make sure that you are figuring out how you can not only send out claims and get the money from the insurance carriers, but figure out how you can best utilize the bill flash solutions and other solutions that are out there for you to bill your patients and get the payments that are in for those visits. And you also need to make sure you ask yourself, as you're evaluating your telehealth system, how does this work with my electronic health record and practice management system? If there's integration that's there that automatically feeds up patient information, if the EHR is automatically tracking how many minutes you're spending on each encounter with a patient, that's going to be something that you'll see in just a couple of slides is extremely critical to maximizing the revenue that you're getting from insurance carriers for the visits that you see. And last but not least, you need to make sure you understand that PCI compliance is not suspended during the current crisis. That means that having your patients call you, give you the credit card over the phone, writing it down on a piece of paper that you then manually enter into a system is not PCI compliant in many circumstances. So make sure that you're following all rules and regulations around credit card processing and billing as you implement the solution that you and your practice decides is best for you. So we talked a little bit about how telehealth varies from payer to payer. We're going to spend a little bit of time here, or probably a lot of time, talking about Medicare, because Medicare tends to be one of the biggest payers that affects most providers of healthcare in the market today. With Medicare, it's very critical that you understand that there are different types of telehealth care. It is far more than just getting on a Skype call with your doctor and when the Skype call's over, the doctor just says, I did a telehealth visit and I'm done. There are different types of visits. Medicare has 3 different types of telehealth visits, and each of them have different requirements, and each of them is paid and reimbursed by Medicare at a very different rate. The first type of visit is a Medicare telehealth visit. The name of it, if you want to take a look at the URL at the bottom of the screen, you can see all of these and a lot of the information that we're talking about today. but it is called a Medicare telehealth visit. That is the only one that is available for brand new patients. So if you have a new patient, you need to make sure that you are following the rules and regulations surrounding a Medicare telehealth visit. They also have something called a virtual check-in, which is a little bit different than the telehealth visit in that it's a lot less invasive, it takes a lot less time, but you can still be paid for it and still provide different levels of potentially non-urgent care utilizing that. The last option is an e-visit. It's very similar to a telehealth visit, but it must be done using a portal and is only available for existing patients. If you didn't get all of that, don't worry. We have lots of slides that are coming up that'll give you some of the details regarding each and every one of those types of visits. So let's start to go through each of them and tell you what they mean so that if you understand them, then you can make sure you're utilizing the tools that are at your disposal to maximize the number of patients that you're able to reach and how you do that. What is a Medicare telehealth visit? By definition, a Medicare telehealth visit must use an interactive audio and video telecommunication system. What that means is in this next point, you must be having a real-time communication interaction between the provider and the patient from their homes or wherever they are. It cannot be a serial interaction like an email might be. It has to be a real-time back and forth between the provider and the patient. There are certain types of providers who are authorized by Medicare to provide telehealth visits. And when I say telehealth visits, that doesn't mean that if you're not on this list, telemedicine doesn't work for you. We are talking about the definition Medicare telehealth visit, which is a certain type of telemedicine or telehealth visit. So if you don't see the type of provider that you are there, don't worry. There's more information for you in the next couple of slides. You just wouldn't qualify for this particular one. But those who do include physicians, nurse practitioners, physician assistants, nurse midwives, certified nurse anesthetists, clinical psychologists, clinical social workers, registered dietitians, and nutrition professionals are all authorized by Medicare to provide a Medicare telehealth visit. Again, if you have any questions regarding who's available or who's allowed to do that, take a look at the URL and the website there at the bottom of the screen. They'll be able to give you some more information on the types of providers. So what else do you need to know about a Medicare telehealth visit? These visits are considered the same as in-person visits and are paid at the same rate as a regular in-person visit. So if you meet all the requirements for a Medicare telehealth visit and you're able to provide care to your patient utilizing that, you don't have to take a hit and utilize a lower reimbursement rate that might be there for telemedicine in a lot of circumstances. You can utilize that to maintain the cash flow for your practice if you can meet all of those rules and regulations surrounding those visits. The next thing that's very important for everybody to understand is that starting on March 6th of 2020 and for the duration of the COVID-19 public health emergency, Medicare is going to make payment for these visits in all areas of the country in all settings. That means previously you could only utilize a Medicare telehealth visit if you were in a rural area that did not have a number of providers that were of that specialty. Those patients were then authorized to utilize a telehealth visit to visit a doctor that might be outside of their area. That changed on March 6th. So now everybody can bill for a Medicare telehealth visit. It's also very important that you understand that in most circumstances, the Medicare coinsurance and deductible would generally apply to these services. There are some exceptions for those patients who are being treated for COVID-19, where the coinsurance, the copays, deductibles have been waived. But for all of the rest of the care that patients are still in need of, like my son Tucker, their coinsurance and deductible would still apply. So make sure that you are billing appropriately, taking those things into consideration. I know that there's a lot of talk out there that copays, deductibles, all of that's been suspended during this national emergency, but that is specifically only for COVID-19 interactions in most circumstances. So if you're providing other types of care, make sure that you're billing appropriately and that you're making wise decisions for the financial and the financial well-being of your practice, because that's what allows you to continue to practice medicine. So let's move on to the next type of visit, Medicare virtual check-in. This is a brief communication service between providers and established patients. So a Medicare telehealth check-in that we just went through can be a new patient. A virtual check-in must be an established patient. And it can be done through a different number of communication technologies, including synchronous or email type, overtime, serial type communication over a telephone, or even an exchange of information through video or image. Patients can send you pictures or videos of what's going on to help you evaluate and prescribe treatment or care plans for them. Medicare will pay for these check-ins for patients to communicate with their doctors in order to avoid unnecessary trips to the doctor's office. This really promotes healthy social distancing and tries to keep everybody safe as the national emergency unfolds. Doctors and certain practitioners may bill for these check-in services. We have a list of who that is in just a slide or two here. The practitioner may respond to the patient's concern on either telephone, audio, video, secure text messaging, email, or the use of a patient portal if you want to submit reimbursement for a virtual check-in. All standard Part B cost sharing is going to apply if you bill for a Medicare virtual check-in. We talked about how this can only be reported if the billing practice has an established relationship with the patient. And it's also important that you note that the individual services needs to be agreed to by the patient. You can't just say, I'm going to provide this to you via a virtual check-in. What you're going to do and how you need to do it, you need to spell that out for the patient and have a record that they agreed to that. So how would you go about doing that? Well, there's two different HCPCS codes that you would use to bill for a Medicare virtual check-in. I'm not going to read this slide to you. There's a whole lot of words that are there. But if you take a look at it, the top code, G2012, that is for a brief live interaction with the patient in most circumstances. It doesn't necessarily have to be live, but that's generally the biggest difference between the top one and the bottom one, is that the top one is if you're interacting with them in real time, and it's about 5 to 10 minutes of medical discussion. If you're using code G2010, that is when you're having the patient submit pictures or videos. It's a serial type interaction, and it's not as much of the live face-to-face, or not face-to-face, but live real-time interaction. You would want to speak with your billing staff, your billing provider, make sure that you're providing everything that they need in order to document those things. You need to make sure that everything that you're getting from those patients is recorded in your EHR and on the patient's chart in their note. You need to make sure that anything that you bill, whether it be to Medicare or another payer, is completely backed up and supported with the information that is in the note. So that means that if you need to speak with your EHR provider and have them update your templates to ask different questions, like what's the duration of the interaction, you need to think about doing that and implement that so that you can get all of the data that you need to support the billing to maximize your ability to get reimbursement from Medicare. I think that I went too far there. Yeah, it went down 2 or 3 slides. So let's move on from the virtual check-ins and talk about what a Medicare e-visit is. This is different than the telehealth visit that we talked about up at the top, in that it is required that they be an established Medicare patient, and they can have a non-face-to-face, patient-initiated communication with their doctor using a patient portal, an online patient portal. The patient must be the one that initiates the inquiry. So if the patient initiates the inquiry and it's an established patient, then an e-visit would apply. The initial inquiry and follow-up can occur over a 7-day period. So each 7-day period can have its own e-visit that is billed. And you would utilize the CPT codes that are listed on the screen here, as well as the HCPCS codes as applicable. Now, we'll talk about some of those codes here in just a minute and let you see what the differences are between them. So you don't need to hurry and write those down, but if you have any questions, talk to your billing staff. We talk to your reseller. If you have any questions, you can call Bill Flash, and we'll try to help you in any way that we can. It's also very important to note with the Medicare e-visit that the patient must verbally consent to receive virtual check-in services as part of the e-visit. The Medicare coinsurance and deductible would also apply to these services. So again, if we're at the beginning of the year right now, there's a lot of patients who haven't met their deductible yet. So we say you're still going to get paid. If the patient hasn't met their deductible, you're still going to need to send them a bill. Medicare Part B is also pays for these things, the e-visits, the patient-initiated online evaluation, as long as it's conducted via a portal. So what do the different CPT codes mean when it comes to a Medicare e-visit? Well, if you take a look at these things, they are identical except for the last probably 10 to 15 characters. If you bill a 99421, that's for a Medicare e-visit that has a duration of 5 to 10 minutes of cumulative service time for the patient. If you want a 99422, it's 11 to 20 minutes, and a 99423, that's 21 or more minutes. What that tells you is that as you are interacting with patients in telemedicine, it's critical for you to note the start and stop times in the patient chart if you want to maximize the revenue that's coming into your practice. If you aren't able to prove that you spent 21 or more minutes caring for that patient or interacting with them, then you wouldn't be able to bill at the 99423 level. But if you do the things that are necessary to show that you spent 21 or more minutes, that allows you to bill at the highest level, which also carries with it the highest level of reimbursement. So make sure that you are tracking the start and stop times for each of the activities that you're doing as you care for your patients via the telehealth options that are there for you. These are the same procedure codes that are used by the other insurance carriers. So if you're not a Medicare provider, that applies to you just as much. If you want to bill for these e-visits using these codes, it's imperative that you're following the rules for your payer, but also meeting the requirements for the code itself and tracking down how many minutes you spent on them. It's also what's interesting about a Medicare e-visit is that these are available for clinicians who may not independently bill for evaluation and management visits. So if your specialty or the type of provider that you were was not available on the first type of visit, the Medicare telehealth visit, you still have the opportunity to provide Medicare e-visits. So if you are a physical therapist, an occupational therapist, a speech-language pathologist, or a clinical psychologist, you still have the ability to provide these e-visits, and you would use the codes that are listed up here on the screen. The G codes 2061, 2062, 2063, and similar to the previous codes that we showed for the other types of providers, the only variation here is on the number of minutes that you're spending with each patient or interacting, doing research, working on that patient's account. You would have the same requirements for tracking down and proving that you spent that time. So just like with the other providers, you want to make sure that you're putting that into your electronic health record. So in summary, these ones are only good for established patients. This is also no longer limited to just the rural settings. Similar to the other visits, it's available nationwide now during the coronavirus national emergency. Previously, they had the same limitations that the first type of visit did, where it was rural health with no providers or a limited number of providers that were able to provide those services. Those restrictions have been lifted. The patient would communicate with you by using online patient portals. It must be initiated by the patient, and the coinsurance and deductible would generally apply, again, with the exception being if it's a COVID-19 case, then most of those have been waived. So if you didn't get all of that regarding the 3 different types of visits, we've got a handy little slide here that breaks it all down to you. What's the type of service? What a description of the service, which codes are you going to use to bill for those services, and what is the relationship requirement between the patient and the provider in order to bill for those particular services. We'll come back to this. If you have any questions on this, we can provide it for you. You can also grab this information from CMS's website. We talk a whole lot about Medicare. What about other payers? There's a lot of payers that are out there, and each of them have their own rules and regulations like we've talked about. I've gone and looked up and provided here some updates from 4 major nationwide payers. If your payer's not up here, don't worry. That doesn't mean that it's not available for you. It just means that you need to go look that up on their website. Most of them have it available right there on the front of their website, and you can dig down into it, see what their rules are. But I want you to see how not only dates vary by payer, but some of the way that they're reimbursing it and the rules that they have vary. So Aetna, for example, has a $0 copay for telemedicine visits until June 4th. Cigna says that if customers need virtual care that's not related to COVID-19, they can utilize their virtual care capabilities or telemedicine through May 31st of 2020. And they specifically call out that out-of-pocket costs, meaning deductibles, co-insurances, and co-pays, may still apply. Anthem's a little bit different in that they're asking their providers to utilize their Sydney Care mobile app in order to connect doctors with the patients. But they're also, for a limited period of time, covering telehealth visits by phone with the primary care provider in your plan until June 14th of 2020. So even if you haven't set up everything that you need for a true integrated telemedicine system with your EHR, you can still continue to provide care to your patients via phone and bill for that through Anthem through June 14th. So that's another couple of months. United Healthcare, for non-COVID-19, they specifically call out that cost sharing and coverage will apply based on your health benefits plan. It's no different if you have a deductible copay or co-insurance for United Healthcare, but they're going to allow you to utilize that with telehealth visits through June 18th. So every single one of them picked a different date: June 4th, May 31st, June 14th, and June 18th. That's why it's important that you stay up to date as the situation progresses, because some of those dates might change. Another very important thing for you to understand: HIPAA during social distancing. This is an announcement taken word for word from the Health and Human Services website, and I'm going to read it word for word to make sure that I don't say anything wrong. But effective immediately, the HHS Office for Civil Rights, OCR, will exercise enforcement discretion and waive penalties for HIPAA violations against healthcare providers that serve patients in good faith through everyday communication technology such as FaceTime or Skype during the COVID-19 nationwide public health emergency. I don't want you to think that I'm saying that FaceTime and Skype are good long-term telemedicine solutions. However, if your practice is in an emergency right now, trying to figure out how to continue seeing patients while you figure out which systems to implement, in the short term, it's perfectly acceptable for you to go through and utilize normal everyday communication technologies to stay in touch with your patients and continue to bill, providing that you're documenting the way that you need to and meeting the other requirements for each type of visit that you submit for. So this can change at any given point in time. They could revoke the national emergency. They could start enforcing this. So if you decide to start utilizing those things, please do so, understanding that this is something that is extremely fluid, and you need to pay very close attention to it, because if they announce that all of a sudden there's restrictions on Skype and you continue doing it, that could open your practice up to HIPAA penalties. So that we don't want you to go too far either way, being lackadaisical using FaceTime or Skype, or saying that you shouldn't ever use it, because right now what's most important is making sure that your patients are receiving care while they're not able to leave their homes. So once you're able to provide that care, the only way that your business can really continue to function is if you get paid for at least some of that care. As we showed you on the previous slides, in many circumstances, Medicare deductibles and co-insurances are still going to apply to telehealth visits. Other payers may vary, but generally, most of them that I've seen are still applying deductibles and co-insurances to non-COVID visits. So for your practice to remain viable, still continue to bill your patients for those. Give them options, make it as easy as possible. Be empathetic with them, especially if they've been affected due to some of the economic difficulties that have come as part of this situation. But that doesn't mean that you can't bill patients ever. Many patients still have HSA and FSA funds that are available for their healthcare needs. If you don't ever send them bills thinking that they don't have it, then you're not going to receive the funds that you need in order to keep your business functioning. In order for your practice to function, you must continue to generate revenue. You have to get paid for your work. Your staff has to get paid for your work. If that doesn't happen, then everybody goes and finds other ways to provide for their families. So make sure that you're exercising both empathy, but also financial prudence in sending out those statements and billing your patients. Bill Flash, the solution offered by NexTrust, allows you to send statements to patients and receive payment from them without anybody ever having to leave their home. As most of you know, as current Bill Flash customers, it's very easy for you to send statements to a whole lot of people without ever having to go to the post office and buy stamps or buy envelopes from an office supply store. You don't have to hand anything off to the mail carrier or take the statements when they're stuffed to the post office. So we are supporting you as we always have in normal times. It has the side benefit of reducing the interactions that people have with each other, really promoting and supporting social distancing. It's also important to note that Bill Flash is integrated into most EHR practice management systems. So not only are you going to be able to get those statements out, but that integration in many circumstances makes it very easy for those patients to pay you online if you're utilizing Bill Flash online payment services. So how does Bill Flash help you do that? Well, you can charge patients for their visit and allow them to pay you through My Provider Link, which is a Bill Flash website. I'll show you in just a few minutes. Once the visits are complete, if there's co-insurance, you can send out electronic statements, but also normal statements through the mail. If your patients still prefer to receive them, you can send those out just like we discussed. Utilizing Bill Flash Pay services allows you to set up automatic, recurring, starting on the date you select payment plans. What that means is that if you want to do something similar to different utility companies or mortgage companies or car loan companies and say, we're going to delay your responsibility in paying 3 months or whatever you determine, Bill Flash allows you to set that up in a way where you capture the payment information now and set it up to occur on whatever date you choose on a monthly recurring interval until that's paid off. giving your patients options to pay their bills makes it far more likely that they're going to pay it versus just sending them a statement for $10,000 and expecting them to pay it. If you break that up, it's going to be far more likely that they're going to actually comply, because that compliance is really automatic. We also offer the ability for you to start letting your patients have automatic payments. Most younger people use automatic payments to pay for their utilities, to pay for their mortgage, to pay for rent. They have these things automatically paid, and BillFlash Pay services allow you to set up automatic payments so that when the statement goes out, it's automatically paid. And I'll show you how to do that in just a minute. We also let your patients store their payment methods. So if you're trying to collect from patients and you're taking it over the phone and writing it down on a piece of paper or storing it on an Excel file on your home computer or laptop, that's not PCI compliant. BillFlash will allow your patients to store those methods online and make it very easy for them to pay. Again, we understand that there's patients who are going to come to you and they're not going to be able to pay. We understand that you need to have empathy towards those patients. We want to provide as many options as possible, but that empathy, it doesn't keep your business functioning. And if your business doesn't function, you can't provide the care that you need to your patients. So you guys, everybody on this call, not everybody, or most of you on the call are already BillFlash customers. You understand all of the different things that BillFlash has to offer, or maybe you understand some of them. But if you take a look at them, BillFlash will allow you to very easily mail printed bills, no touch, social distancing, send patient an eBill, an electronic emailed notification of their statement, no touch, no interaction, supporting social distancing, automate the enhanced billing and integrated collections options, allow you to collect payments or submit them yourself, or let them be patient-initiated online payments. We give you one platform that allows your patients to not only receive care from you via your chosen telehealth vendor, but to pay for that care using BillFlash's online payment functionality that integrates with most of your practice management systems. So, how does BillFlash support that? What does it really look like when you start utilizing BillFlash Pay services? What would a patient need to do in order to support that? I'm going to come out of here and we are going to go into BillFlash and show you how that works. So when your patients receive a statement from BillFlash, you are all aware of how this works, but I want to make sure that you see something specific here. This is what their statements look like. By and large, you see it, you're familiar with it. When you use BillFlash Pay services, it doesn't matter whether they get a paper statement or electronic statement. These two things are going to be here on the statement. What are they? These are the two numbers that are needed in order for a patient to make a payment to you online. If they receive a paper statement and they go to this website, myproviderlink.com. Let's see if I can click correctly here and show you what it looks like, myproviderlink.com. Your patient comes right here to this screen. You'll have to forgive my internet. All internet has been slow in my neighborhood because everybody is here working from home. So give me just a second and there it comes up. But once they get here, there's an option that I want to draw everybody's attention to that's called guest pay. Guest pay is very important for practices who don't have the time to interact with patients who say that I forgot my login and passwords for the online payment portal. If your patient comes here and clicks guest pay, it's going to ask them for two numbers. You'll see it right here. It says enter your account number from the bill and the form ID. If we come back here and we'll take a look, account number, form ID. If your patient fills out just those two numbers, they'll be brought to a payment screen that I'll show you in just a minute when I sign in and show you how it works on the other side. And they don't need to have a username. They don't need to have a password. They're not presented with any of the information that would make it a HIPAA issue. They're just presented with a payment portal that says you owe $130, for example. And how would you like to pay? They enter their credit card information and it goes right into your account and loads right back into your practice management system if you have it integrated with BillFlash. If it's not integrated, it still goes into your account and you have a report that you can print out and utilize to enter that into your practice management system. I'll show you how that works in just a minute. But I want to show you how a patient would interact with this if they actually signed in. So I'm going to sign in and show you what a patient would see if they were using my provider link and had set up their username and password. I have a patient here, James Dugan, who has a statement that they received today. When eBills go out from BillFlash, they actually are sent out the same business day and are available for the patient to see immediately. So I sent this one out just a little bit ago. If I click on it, you can see James Dugan received a statement here for $130 that it reflects right back here on their portal. If they want to see what that visit was for, they can see it. All the messages that you're familiar with that you can enter onto BillFlash are there. And then they have the option to pay that bill, which is what you really need them to do. They click the pay button, they're brought to a screen right here where they are asked whether they want to pay the total amount due from their statement or any other amount. You can put in there anything you want, a penny up to, I tried one earlier for $100,000. And whatever the patient wants to pay, they have the ability to do that. They can send a message to your practice. If they need to communicate something to you or ask a question, they can do that. Here you'll see how a saved payment method would look. James Dugan has saved a checking account ending in 6, so he doesn't have to go remember to type all that in. So he's going to pay his total amount due of $130 using his checking account. He hits submit, and he immediately receives a receipt right there on his screen that he can print out from the comfort of home. Didn't have to interact with anybody. Again, supporting social distancing and supporting getting your practice paid so that you can continue to function. When James is completed with that, if he wants to get a history of his account, you can go back in here. He can see every statement that he's ever received. Not only can he see the statements, but if you pay services, he'll be able to go get a record of all of the different payments that he's made as well. When everything opens up again, BillFlash Pay Services actually supports in-office payments as well. You can have your credit card swiper machine there and have it integrated right with BillFlash so that all of those payments will be registered here on this portal as well. So imagine come tax season and James is trying to figure out how many payments he's made to your practice so that he can claim that on his taxes. He doesn't have to call your practice and ask you to run a report and send it to him. You can just point him towards the portal here and he has everything he needs to get the total number of payments that he's made to your practice over the course of the last year. So that saves a phone call and makes the functioning of your practice a whole lot easier because your staff can focus on different things. So once that payment has been made and is done, as many of you know, it integrates back into a lot of practice management systems. I'm going to show you how it integrates into a system called Metasoft. If you have a different system, you need to make sure you check with your BillFlash representative or with your software provider to see whether BillFlash is integrated or not. In this circumstance, it's fully integrated with Metasoft. If I come here to the deposit list, there's a button that says ePay. I click that, and you'll see that the payments that I just made online, I tested one earlier to make sure it was that I wasn't having any issues, but both that one and the one that I just barely made were brought right back into the practice management system where I only need to go and then apply it to the charges. That same functionality exists with a lot of different software systems, and it's impossible for me to show all of them to you today, but that's how it works when it is integrated back with your practice management system. If it's not completely integrated with your practice management system, you can still utilize the Bill Flash Pay services. The payments will still go directly into your account the same way that they do for those that are integrated. You would just come here and you'd be able to run reports that are going to be able to show you the payments that you've been receiving. So if you wanted to come here and run your payments, I'm going to run it for the month to date or for whatever range that you would like. You can run that report and then use that to go update your practice management system if that's not integrated. Like I told you, the internet to my home has been very, very slow for the last week, so it might take a minute. There it comes. You see all of the payments that have been made, and that will allow you to then go enter that into your practice management system. All of these different options that are there are how Bill Flash will allow your patients to not only interact with you from a telehealth perspective, using whichever technology you decide to use to provide those services, but if you can't get paid for those services, then your practice won't continue to function. Bill Flash is the key there that allows you to keep the revenue flowing for the visits that you're able to provide through your chosen telehealth platform. So please offer those visits to your patients. Bill them for those visits when you can, and that will allow you to continue to get paid. Now let's take a look at two other things, and then we'll move back to the PowerPoint. If you want to set up, we talked about payment plans and auto pays. It's very easy for you to do so. If James Dugan has a payment plan that you want to put him on because he has a giant balance, all you would do is come in here to the payer interface in Bill Flash, bring up James's account and click Add a Plan Pay. And here you have the ability to not only put notes on James's account regarding the payment plan terms that you've agreed to, but you can specify your monthly payment amount. Right now we have that set up for James as $1,000. And say he has a $10,000 bill, you can put 10 there, and then every month for 10 months, James is going to automatically have his either card or checking be charged for that amount on the day of the month that you specify. So like I told you earlier, if you wanted to take a patient who was having stress and help them delay that without putting your practice in as much jeopardy of missing out on the payment, say you wanted to give James until August to start paying that. All you would need to do is select August as your starting date if it was August 1st of 2020. And what that means is that on August 1st, we're going to hit the credit card or checking account that you specify down here for $1,000, and that's going to continue on the 1st of every month for 10 months. You don't have to remember to charge it. It's automatically going to happen as long as the credit card or checking account has the funds available and it's not expired. That the money is going to flow right into your account, and it's going to update either into your practice management system or onto the reports that you're using to update your practice management system. So that makes it very easy for you to help accommodate your patients to experience some of the financial anxiety that exists in today's climate. If you want to set up auto pay, it's a very similar process, except for you don't need to specify the number of times that payment is going to occur. When you want to set up a patient for auto payment, just as a reminder, that's where the statement is sent either on paper or electronically, your choice, or both. And automatically having that hit either a credit card or a checking account and withdraw the funds and put them into your account. So if the patient says, I authorize your practice to automatically charge my credit card or checking account for up to $50, and you send them a statement that is $100, for example, then as soon as the statement goes out, $50 will be charged to the card or account that's on file, and $50 would remain to go out on the next statement for you to collect through your normal means. If the statement was less than $50, if it was $30, we would just charge that $30 amount. It would go right into your account, and the statement would be paid in full automatically, the same way that people pay their utility bills. It works, like I said, with both card and check. You have the ability to specify the maximum payment amount on a patient-by-patient basis. And what that allows you to do is create different options for your patients. So if you want to give them incentives or reasons that you would want them to sign up at a 50 or 100 or a 200, whatever levels that you as a practice determine are best for you, you have the flexibility to do that, and you don't have to have it be the same for every single patient. And the same thing is applicable to plan pays. So I hope that shows you some of the options that are there for helping keep your practice financially viable as you use telemedicine to provide services to your practices and keep those payments flowing from the patients to your practice in as many different circumstances as possible. So let's go back and wrap this up with the rest of our presentation here. We've got a summary. This is what we've talked about today. Adapting to the impact that COVID-19 is having on patient care, billing, and payments. Make sure you understand the options that you have for providing telehealth to your patients. Understand what that means from a billing perspective and what you need to do to bill the different types of visits that are there. We want to help you simplify billing for your telehealth visits to your patients. So take a look at the options that are there for Bill Flash and try to implement things that will allow your patients to pay from the comfort of their home rather than waiting for this to lift and when they come to your office asking them to pay it all when they're standing there in front of you. Offer them online payments to help promote social distancing and keep them and your staff healthier, and set up payment plans to help make those payments a lot more manageable for the patients who might be affected by the economic impact of the coronavirus. There's a number of different entities that are out there working together to help your practice succeed. NexTrust Bill Flash is just one of those companies. You need to make sure you're also staying in touch with your billing software company or your electronic health records company. Your value-added reseller is going to play an absolutely critical role in this. Your value-added reseller or VAR is usually the person that you call for support on most of your systems that you utilize to run the business of medicine. So if you don't know who that is, then that's the way that I think is the easiest for you to figure out who your value-added reseller is. But you need to be working hand in glove with your value-added reseller in making sure that all of the different technologies that you're implementing are utilized to their fullest capacity to keep your practice running well. With that said, if you need to have a personal demonstration or to have a free consultation on anything that we've discussed today, our contact information is up here on the screen. There's a phone number, there's an email address, or if you want to ask in the webinar chat, give us your information there and we'd be happy to set that up for you. Now, I promised that we would get to questions and answers. So we'll move on to that. And Mari, have you been aggregating the questions in the chat as we've been going? And do we have questions that we can answer? And before you answer, I just want to remind everybody, if you have a question or think of one now, utilize the chat service on GoToMeeting and ask those, and we will answer as many of them as we can right now. So Mari, do you have any?
Thank you. Yeah, Tony, we do have a few that are asking about coding questions, and I've tried to reply to everybody. And what do you want to address that, Tony?
So the coding questions, the easiest way that I can help you with coding is to say that every single visit and every single practice is different. There's rules that payers and Medicare, everybody has around each of these different codes. You need to make sure that you're working with your billers, that you have professional billers who are able to answer these things for you. There's also a number of online coding resources that you can turn to, and that's actually something that we are looking at putting together for another webinar. We're trying to put together a series of these webinars that help you with a number of different technologies that your practice can utilize during this period of social distancing and national emergency to run your practice. This is just the first of what we hope for many. So if you don't have an online coding option that helps you with which codes to use, which ones to choose in different circumstances, I highly recommend that you go explore options out there for that. Talk to your value-added reseller. Most of them have options for you that you can implement very, very quickly and very easily. So that would be the first place that I would point you to answer that question. Reach out to your value-added reseller or your software provider. Most of them have that. But I can't tell you that this is the circumstance that you would use for each and every code that is there. You need to make sure that you're consulting coding experts to answer all of those questions. I can give you basic guidelines, show you the codes that are available for the basic visit, give you some basic information like we did, but outside of that, you need to make sure that you're referring to a professional coder to make sure that you maximize your billing.
And then, Tony, we did have quite a few that are wanting more information on pay services, and I would just echo what Tony said at the end, which is to put that in as a question, or you can contact us through this information that's on the screen right here, and then we will get back to you on that. We'll contact you directly. And then all the other questions, Tony, are really ones that we need to follow up on.
Okay. Well, if we need to follow up, if we have not answered your question, I promise you Mari is outstanding at aggregating this and keeping us all on our toes, making sure we get back to you. If your question was not answered during this session, you can expect a call from someone at BillFlash to help you go through that. If there's anything that you think of at any point in time after this call or at any point over the next little while, the phone number, contact information is up there on the screen to get in touch with us directly. I would also, again, reiterate that your reseller would be a great place for you to get some of this information as well. So reach out to us, reach out to your reseller. We are all here to help you and your patients and all of us get through what is a very tough time for our country and the world. So if there's anything that we can do to make this journey easier for you and your patients, please don't hesitate to reach out, and we will do everything we can to support you in that. So if there's no other questions, Mari, then I think I'll talk really slow just in case something came in. But if not, then I think we can wrap it up. I thank all of you for your time today. I hope that you all stay safe. Thank you for being in healthcare. Thank you for going to work every day and helping our country through a very, very difficult time. You are the heroes of this story, and we appreciate everything that you're doing. Thank you very much. Have a wonderful day. Have a great weekend, and we'll talk to you again soon.